I'm going to give this to you now because I have a tendency, when I get in the second half of this, I'm going to go like crazy. All right, the second half of this is going to be devoted entirely to the treatment of periodontitis and the use of lasers. And I'm going to go a little faster than I have, even though this may be the most important part of it. And I will tell you is that we get close, and if you start going to sleep, I'm going to yell at you because I'm going to be march. I got to stay awake, so I'll march up and down the aisle. There's some real hot issues in this area right now, not the least of which is advertising and marketing and some of the things that are being said about how you treat periodontal disease. Several of you have asked me these some interesting questions over the break. The treatment of periodontitis with lasers has evolved, and then again it hasn't evolved much. It started out being called laser curettage, and then it became laser ENAP. Now ENAP in periodontics stands for excisional new attachment procedure, and that was a surgical procedure designed to use around single-rooted teeth to preserve the dental papillae. And it was developed by Ray Yuckna, Pete Fetty, and Art Bernino when they were all at Bethesda Naval Hospital together at the graduate program of the Navy for periodonts. They printed, there were a series of 3 papers on ENAP, the first of which was published, I think, was about 1968 or 69, and the last one about 1970 or 71, thereabouts. It started out in Ray Yuckna, and the reason I keep mentioning his name because he now is he's a consultant for Millennium and does a lot of work for them. He said in that first article that the ENAP, the excisional new attachment procedure, was a curettage by scalpel. In the late 60s, we had the first world workshop in clinical periodontics. Experts from all over the world were invited to this, and they reviewed the literature in certain areas, and they came to conclusions. One of the conclusions they came to was that the laser, or the curettage, had no basis for treatment of periodontitis. It was a worthless procedure. That was in 1969. And the reason for that is it was proven time and time again that you can do root planing and remove all the accretions on the root, inadvertently do some curettage, and you end up with the same result. But it's possible to do a curettage and not do the root planing. There was a code number for a long time for genuine curettage, 4220. It was so abused by dentistry and known since 1969 to be a worthless procedure under most circumstances that the insurance industry did away with it. And now we're back doing curettage with lasers and calling it bigger and better and something different. Well, it ain't. Curettage is a curettage is a curettage. I don't care whether you use a Cavitron, a piezoelectric, a Gracie curette, a laser, or a scalpel. It's a curettage. But because that got hammered in the literature, and some of it by me, I'm glad to say, the laser ENAP progressed into a laser-assisted new attachment procedure, and that was trademarked by Millennium. These are the instruments that are used primarily for that procedure: diode, ND-YAG, erbium chromium, and the erbium YAG. And it's because they're all absorbed in water to some degree and not absorbed appreciably in hydroxyapatite, although the erbium YAGs are. So the basis of any dental periodontal procedure, dental laser perio procedure, is based on the perceived benefits of 3 things. 1, that a subgingival curettage is beneficial. 2, the so-called laser assisted new attachment procedure, and there's a whole protocol for that that I'll tell you about. And then the fact that you're inducing significant decreases in subgingival bacterial loads. That's the basis for this. Started out in 1990. Before I ever got involved in it, it was called a breakthrough treatment for periodontal disease, laser curettage. Now, if it wasn't breakthrough in 1969, why the hell is it in 1990? Pulse Master, I don't know who they were. Vaporizes gently, removes diseased periodontal tissue in a less invasive fashion than with a scalpel. Yeah, so what? What's the point? Is it vaporized gently? I showed you what it does. And if that's gently compared to that scalpel incision, then somebody got a screw loose. That doesn't look gentle to me for some reason. Every time I look at that, it looks pretty gross. That's what they're talking about. And then in 1996, Millennium, before they had their perio lathes now, came out and they had another breakthrough treatment. A laser ENAP, laser excisional new attachment procedure, 1990. Periodontal surgery you and your patients won't fear. Already, in 1996, they're using negative advertising. They can't talk about their instrument in a positive fashion, but they can sure as hell put us down, and by us, I mean periodontists, because we do surgery. And consequently, we scare the hell out of patients, and we hurt them, and we beat them with 2x4s and whips, and we flagellate them all the way out the door, but the silly people keep coming back. 2004, Lars, which is a Swedish outfit, has an instrument, and they're still calling it curettage. It just won't go away. Now look at those photographs there, these drawings. Pocket with calculus, measured it with periodontal probe, scaling and root planing, getting rid of all the accretions, go in with the laser, do the curettage, and then they coax that tissue back so that if there's any bleeding or fibrin, it seals it to the... I know there's only 3 or 4 of you in here as old as I am, but that's what we did with the ENAP and the scalpel back in the early 1970s. Exactly what we did. So it's interesting. In the treatment of 4 to 6 millimeter pockets, curettage plus scaling and replaning has no advantage over scaling and replaning alone. Echeverria, Cafethi, 83, Lindy and Nyman in 85, Sigmund Ranford up in Michigan in 87. They all said the same thing. To make matters worse, gingival curettage has no application in the treatment of adult periodontitis. That was the 1989 World Workshop. Ken Colliquor said that in his review. The Europeans are much more subtle and erudite and sophisticated. Gingival curettage would not seem to be warranted in view of comparable clinical results achieved with root surface instrumentation alone. In other words, it doesn't work. Why do it? That was Kaiser, 1993, in their first European workshop. Well, nothing's changed, except Millennium, and now 2002, they have the new standard of care for periodontal therapy. They broke through in 1996. 6 years later, they've established the standard of care. That's quick, very quick, considering in 2002 not very many of us were doing it. So you look at that, probing the pocket, doing a excision, a pretty wide excision with that laser. That's a hell of an incision. But when they do it, you notice they don't remove the connective tissue papillae. They actually claim that they can remove only diseased tissue with it, and it leaves behind the healthy tissue. They then scale and root plane. Then they go back in with the laser a second time because this produces some bleeding, and they set up that clot with the laser. Now, and I've seen this, it does work. I don't know quite what happens, but the fibrin in the clot is somehow activated by that laser. and it becomes like raspberry jello. It does seal the soft tissue to the root, and you can push on it, and it rebounds. So something happens there. And they coapt it, and then they claim that sealing there of the root and the connective tissue prevents the downgrowth of the epithelium and prevents a long junctional epithelial attachment. And so you then get a connective tissue attachment here, which is conducive then to the formation of cementum, bone, and periodontal